Hello, my name is Summer Jenkins, and today I'm going to be presenting the practice pearls on gout. First, we're going to talk about the pathophysiology of gout, some risk factors, the clinical presentation, physical exam findings, the diagnostic criteria, treatment options for gout, and then lastly, how gout will affect you as a future nurse practitioner. So the pathophysiology of gout, gout can be contributed to metabolic and genetic disorders that result in hyperuricemia that form the monosodium urate crystals. Chronic inflammation leads to high urate levels, and these MSU crystals must deposit in the tissue before gout can occur. Hyperuricemia levels are considered to be greater than 6.8. This is necessary for gout to occur, but most individuals will not experience gout even with a level greater than 6.8. Comorbidities have a significant impact on gout. These include hypertension, obesity, insulin resistance, and coronary artery disease. Modifiable risk factors for gout include obesity, alcohol use, consuming soda and fruit juices, if you've had a recent organ transplant, if you have high blood pressure, or you are on loop diuretic therapy. Non-modifiable things you cannot change include male sex, advanced age, and your ethnicity. Some other risk factors that can contribute to gout include trauma, surgery, and sepsis. So when a patient presents to the clinic, they are going to say that their pain started late in the night, around 2 o'clock in the morning. Their first metatarsal phalangeal joint has extreme pain. It's warm to the touch. It's red and shiny, and even the bed sheet hurts to go across the toe. The pain steadily increases over 8 to 12 hours. Although the pain is typically going to present in that first joint, it can also occur in the ankle and the midfoot. With with chronic gout, you can see tophius joints like in the elbow. Some of these patients are going to present with fever and they're going to require a more extensive workup. This is what gout looks like. In picture A, that is the inflamed joint, and then in B is when we're doing the aspiration to diagnose gout. This is some diagnostic criteria that you can read over. If you score less than 4, you typically do not have gout. If you score greater than 8, then the probability of gout is very high. Although it's nice to have these tools to diagnose gout, 9 times out of 10, gout can be diagnosed just on clinical presentation and what the patient is telling you. But we can also do a synovial joint aspiration, which is the gold standard for the diagnosis of gout. You will see those MSU crystals under the microscope. On lab findings, there'll be an elevated white count, and also your SED rate and your C-reactive protein will be elevated as well. Plain x-rays can see repeat flares of gout and visualize those tophius gout on the elbow that I was mentioning earlier. And ultrasound, you can also see gout as well. You can see the crystals forming before the first gout attack even presents. Treatment recommendations. The overall goal of gout is to relieve that acute pain that one presents with. So for the acute pain, we can do NSAIDs, colchicine, and steroids, and then prevent future attacks, you can use alpurinol, which is recommended for the GERD population. And always remember, never give alpurinol to an acute attack. Non-pharmacological, consume less alcohol, consume less red meat and seafood, lose and maintain a healthy weight, and stay hydrated. Lastly, how is gout going to affect you as a future nurse practitioner? So for interdisciplinary teamwork, this requires you as the nurse practitioner knowing how to diagnose gout and possibly doing joint aspiration. The radiologist tech needs to know how to do the proper film so the radiologist can read them. And then the pharmacist will be filling the medications, and they need to be aware which medication you can use for acute versus chronic gout. Informatics has advanced the way that we can diagnose gout. This includes the use of the ultrasound machine. Most of the time, you can see those MSU deposits on the ultrasound long before the first gout attack actually happens, and you can go ahead and start doing those modifiable risk factors. Gout costs approximately $27 million each year in the United States and affects over 5 million people annually. To prevent gout is the primary goal of the primary care provider to help reduce that financial burden that gout presents each year. Patients that have comorbidities need to be screened for early gout attacks and taught how to prevent gout attacks before they actually occur. With ethical decision making, it's important to consider the geriatric population because they will present with gout more often. Studies have shown that when people are compliant with medications and preventing gout, that repeat flare-ups typically do not occur. And then with cultural diversity, gout was once referred to as the disease of the kings during the Depression because it was believed that only the rich got gout because they could actually afford to drink and eat alcohol and red meats. But now gout affects individuals from all cultures, and it is seen prevalently due to obesity and hypertension. As a future nurse practitioner, it is an imperative to understand that every culture is now susceptible to gout, not just the rich. And then these are the references associated with the gout presentation. Thank you for your time.